Equipment Lesson 17 covers image artifacts in digital radiography. An artifact is any density or structural pattern on the image that does not represent actual patient anatomy. Artifacts can mimic pathology, causing false positives. They can obscure pathology, causing false negatives. Both outcomes directly harm patients. Recognizing artifacts is a core radiographer competency and is heavily tested on the ARRT. 12 minutes. 3 artifact categories. Exposure artifacts, caused by too much or too little radiation reaching the detector. The most common category in clinical practice. Equipment artifacts, caused by detector element failures, grid problems, or processing hardware issues. And handling artifacts, caused by improper cassette care, plate storage, or positioning errors. When evaluating a potential artifact versus true pathology, ask one question. Does this finding appear in the expected anatomical location? Artifacts often cross anatomical boundaries. Pathology does not. An artifact may also reproduce identically in the same location on multiple images. Pathology is unique to each patient. If an artifact compromises diagnostic quality, a repeat is required. If it does not obscure clinically relevant anatomy, the radiologist determines acceptability. All artifacts must be documented. 5 exposure artifacts in order from most to least common. Quantum Mottle, the most common. Grainy, sandy, mottled texture throughout the image, most visible in soft tissues. Cause: insufficient MOS, too few photons reaching the detector. D1 will be significantly negative. Fix: increase MOS to achieve the target D1. Overexposure: image appears visually acceptable, but D1 is elevated. No visible artifact until severe overexposure. Fix: monitor D1. Reduce MOS to target. Investigate dose creep. Double exposure: 2 overlapping images visible. Cause: CR plate exposed twice before reading or detector reset failure. Fix: erase CR plates before every use. Verify DR detector reset function. Fog: overall reduced contrast. Uniform gray overlay. Cause: CR plate exposed to light, background radiation, or not erased before use. Fix: store plates away from radiation sources. Erase before use. An histogram error: image brightness or contrast appears wrong despite adequate technique. Cause: collimation error, metal objects, or anatomy outside the field altering the histogram analysis. The system calibrates the display to the wrong anatomical reference. Fix: collimate to anatomy, remove dense objects from the field, and reprocess with the correct histogram. Grid artifacts are among the most tested equipment artifacts on the ARRT Registry. Moiré pattern: a regular undulating wave pattern across the image. Cause: the grid frequency is harmonically related to the detector sampling frequency. The 2 regular patterns interfere with each other. Also caused by very slow bucking motor oscillation or too short an exposure for the grid to complete its travel. Fix: use a grid whose frequency is not harmonically matched to the detector pixel pitch. Grid cutoff: edge density loss, decreased density at both lateral image edges. Cause: a focus grid used outside its focal range, too close or too far. Also caused by the grid being placed upside down. Off focus produces gradual edge fall-off. Inverted grid produces the characteristic pattern of severe density loss at both lateral edges with preserved density at the center. Fix: verify SID is within the focal range. Check grid orientation. Visible grid lines. Find parallel lines crossing the image. Cause: stationary grid with low frequency, less than 60 lines per centimeter, or bucky motor not completing full oscillation. Fix: use high-frequency grid for stationary applications. Verify bucky motor function. Off-center cutoff: asymmetric density loss, one side darker than the other. Cause: central ray aligned off-center laterally on a focused grid. Fix: center the patient and beam over the grid center. CR artifacts: 5 to know. Ghost image: faint prior image overlying the current exam. Cause: incomplete PSB plate erasure. Most common CR artifact on the ARRT Registry. Fix. Ensure complete erase cycle. Check erase lamp function. Scratch and line artifacts. Linear marks. Cause. Dust, debris, or physical damage to the PSB plate surface. Fix. Clean the reader regularly. Retire damaged plates. Image fading. Reduced density when image is read after long delay. Cause. The latent image stored in the PSB plate fades over time, especially at elevated temperature. Fix. Read plates within 8 hours of exposure. White or black border bands at plate edges. Cause. Plate not seated correctly, causing a light leak in the cassette. Fix. Inspect cassette latches and light-tight seals. DR artifacts. 5 to know. Dead pixels. Bright or dark spots in fixed locations across multiple images. Cause. TFT detector element failure. Fix. Flat field recalibration corrects minor dead pixels. Persistent failures require detector service or replacement. Lag artifact. Ghost of a prior image from incomplete detector signal clearing. Fix. Allow adequate interexposure clearing time. Detector service if persistent. Sensitivity, non-uniformity. Uneven brightness across the image. Cause. Detector gain calibration drift. Fix. Perform flat field gain calibration per manufacturer schedule. Pixel column or row dropout. Bright or dark stripe across the entire image. Cause. Complete failure of a detector element column or row. Fix. Detector replacement required. And backscatter. High-density artifact at image edges. Cause. Radiation reflecting from supporting structures back to the detector. Fix. Use backscatter protection behind the detector. 5 processing and display artifacts. Aliasing, also called Moiré fringes from undersampling. Fine repetitive structures such as grid wires, stent mesh, or mesh gauze are sampled below the Nyquist frequency. Appears as a wave interference pattern. Cannot be corrected after acquisition. Prevention only through appropriate grid frequency selection. Edge enhancement artifact. Ringing. Sharpening filter applied too aggressively. Creates halos or dark lines around high contrast edges. Reduce the edge enhancement setting in the image processing protocol. Stitching artifact. In long leg or full spine studies. Misregistration at the seam between detector positions. Appears as a step discontinuity in bony structures at the joint, caused by patient movement between acquisitions. DYCOM processing error. Incorrect image processing algorithm applied. Image appears globally dark, light, or with wrong contrast. Fix. Reprocess with the correct algorithm from the stored raw data. No repeat required if raw data is saved. Window and level error. Incorrect window width or level at the display workstation. Not a detector artifact. Adjust display settings. No repeat required. The frequency chart on this slide shows the distribution of artifacts in a typical digital department. Exposure errors account for approximately 45%, by far the most common category. Grid artifacts, 20%. CR plate artifacts, 15%. DR detector artifacts, 12%. Processing errors, 8%. 5 prevention strategies matching each category. Monitor the one on every exposure. Catch exposure artifacts before they become patterns. Annual grid inspection. Fluoroscopic examination of all grids for bent strips, missing interspaces, and alignment problems. CR plate maintenance. Clean readers regularly on a manufacturer schedule. Retire plates at end of service life. DR flat field calibration. Perform gain calibration per manufacturer schedule, typically monthly. And maintain an artifact log. Document every artifact by type, location, and frequency. Tracking helps distinguish equipment failures developing over time from random events. 3 artifact identification questions. These are exactly how the ARRT tests artifact recognition. The answer is B. The PSB plate was not adequately erased before reuse. A ghost image in computed radiography results from incomplete erasure. Residual trapped electrons from a prior exposure contribute to the next readout, producing a ghost overlay on the current image. The erase lamp must complete a full cycle. This is the most common CR artifact tested on the ARRT. The answer is B, Moiré pattern from grid detector frequency interference. The Moiré pattern is a wave interference artifact caused when the grid frequency is harmonically related to the detector's sampling frequency. It appears as a regular undulating wave, not grainy like quantum Mottle, not a ghost image, and the D1 is normal, so exposure technique is not the issue. The answer is C. The grid was placed upside down. Density loss at both lateral edges with preserved density at the center is the classic pattern for an inverted focused grid. When a focused grid is inverted, the lead strips angle away from the central ray instead of toward it. Primary beam is absorbed at the edges while passing through the center. The SID of 40 inches is within the grid's 40 to 72-inch focal range, so off-focus is not the cause. You covered artifact definitions and clinical impact, 5 exposure artifacts with their causes and fixes, for grid artifacts with their distinctive appearances, 5 CR and 5 DR specific artifacts, 5 processing and display artifacts, and artifact prevention strategies with frequency data. Artifact recognition is a clinical skill. Use these patterns every time you evaluate an image.